All right, if anyone's in the session with me here, please, I see people growing in here. You just have to request your audio and your video, and you can ask me some questions, or else you can type in the sessions area and I can answer them for you. If you don't want to be on video or audio, that's completely fine. I can answer your questions, so you can just type your questions in this chat area under sessions. There will be people that are joining us and popping in and out and listening to what we're saying. So feel free to jump in and out. And if you want to ask me a question and are okay with turning on your camera and your audio, I will let you in. So please request away. I see people are starting to come out of the stage area, go into sessions, which is awesome. Okay, Rebecca, great question. All right, so I'm just going to repeat the question in case people are unable to see the chat. It says, hi, Catherine, such a great event. Thank you so much. The platform has been outstanding. I'm so happy because it's our first time on Hopin, and this has been a new experience for us. So I'm glad you found it easy to maneuver. I'm curious how things are going with Leaf 411. Let's answer that one first. Things are exploding. We have so many things happening all at once. Jennifer, Axel, and I are just, doing our best to, when we see that need, when we see that problem come up, we're trying to create solutions for those, trying to build programs. But we really needed to take the time to make sure that each program was really thoughtfully done. So we've slowed down a little bit to really look at the 3 programs that we created, because I'll talk about the 4th one we have coming up in just a second. But we have the hotline that we've got, really well-oiled machine there, but gosh, could we use more nurses on that hotline? We are desperately trying to look at all avenues of funding, because we really found it important to pay for our nurses because they're highly skilled. They have a license behind them. They have a huge responsibility, and they take that responsibility very seriously. So they have ongoing education that they cover, that they pay for, and so we pay them. We wanted to make sure that every one of our nurses is a paid employee, first and foremost, to make sure that you're getting the dedication, the enthusiasm that you, the public, deserves when they're answering the phone. So that's how our Leaf 411 is expanding in the hotline. And then there's the outreach. We created this Leaf Learning series. We are hoping that this is going to become it's definitely going to be an ongoing series. We haven't quite figured out yet how soon each one will be. We can't wait to get the feedback from this one, from everyone, all of our colleagues and our friends and our family, the public, to say, what they loved about it, what they would like to see different. We have a survey that's available in our expo booth that you can fill out and help us. Your feedback really helps us figure out, the best way to bring this Leaf Learning series to you. Our affordability program, gosh, we just started that not too long ago, and we've got the wonderful Heather and Amy from American Medical Refugees that are chairing that and really working hard to take in all those applications, created that platform, really working with our industry members to see if there's any donated products. If they are able to do that, that's great. Then we need a place that we can service those families or any of their members and give out those donations legally through dispensaries. So they are taking the time to set that up. And so we're really working on that affordability program, getting that fine-tuned as well. And then we have our Leaf Nurse Network program that we're creating. It's coming soon right now. We're working with Eloise Thiessen and Radical Health and kind of starting to build what that next program is going to look like, because we do have nurses all the time saying, I love what you're doing. I want to be a part of it. And we want them to be a part of it too. So we're guiding them right now on, where do you go for that cannabis education? Where do I go? How do I become a Leaf nurse? Leaf 411 nurse on that hotline. Well, we need to make sure that you have the certifications that we do, which is Radical Health, and we are all members of Cannabis Nurse Association, American Cannabis Nurse Association, and the Cannabis Nurse Network, and we've even got some others that are the Medical Cannabis Institute certifications. So lining all that up, hopefully packaging it neatly really soon. We're going to be working on that towards the end of this year and putting that together, but we're building that as well. How many hours and what are your hours? How many nurses and what are your hours? So right now we've got 3 of us online taking those calls Monday through Friday from 9 a.m. Mountain Standard Time to 7 p.m. Whitney's actually on the phone right now. Hopefully she's handling that right now, because I've had to take my time out here, and we have but what's wonderful is that we have voicemail as well. So thankfully everybody has listened to our opening message on our hotline. If our nurses are busy on the line, we still will get back to you. We guarantee that we will call you back as soon as we have a nurse available. So we will, if you leave us your name, you don't even have to leave us your name, you just leave us your phone number and give us an idea of the best day and time to call you back, and our nurses, as soon as one's available, will call you back. So we have that availability. And also on chat, we implemented our chat feature so people can actually type a question. If we're not online because we're taking phone calls, then that gets submitted to us. So we can capture your phone number if you give it to us, and we can call you back, and even your email. So that's another way that you can get a hold of us too, through that chat feature. We put it all as optional because we want to keep anonymity number one. So if you don't want us to know who you are or anything about you, that's great. You can keep trying to call our phone line, and we have our nurses online to help you. But we do have a way that you can access us. What's wonderful about chat too is that if you're chatting with us online and you put your email address in there, you get a full transcript of that conversation, which is wonderful, because a lot of times, even like today, you're learning and listening to all this information and you've forgotten, like, oh gosh, what did Dr. Dave say? Or what did Catherine say in my chat? What was that ratio that she said I could look for that may be beneficial? You get that email, transcript emailed to you immediately after we conclude our chat session. So that's another helpful way. Yep. What kind of questions are you receiving? I'm going to answer that, but I'm going to let somebody in too. The questions that we are receiving, gosh, all over the board. Some of the ones that we receive are mostly about, the difference between CBD hemp and, I think she jumped off that. I let her in, she jumped off, but that's okay. You can ask me a question through the chat feature if you can't turn on your camera or your audio. So the questions we get are a lot about reading packages. How do they even understand some of this that's on their packages? It's hard because a lot of people will look at a tincture bottle and just think, okay, I need to take multiple of these full droppers, and we have to explain to them exactly how much is in there. We actually do the math for them. We'll figure out, read us what that package says. Sometimes at the same time, we're going on to their websites, those brands' websites, so we can see a picture of what that product is that they bought. We guide them on serving sizes. This is a big questions we have. What's really interesting and good to know that most people that call us, everyone that calls us actually wants to use safely and effectively. They really do want to use safely. They want to be with their family and friends. They want to earn a living. They want to be productive in their community. They don't want to just disconnect from life completely, which unfortunately is some of that language that you hear for some of the people that are questioning if cannabis is truly a medicine, so it's great that people are actually out there asking, I want to use cannabis, but I actually want to do it safely and I want to be responsible using it. So that is a lot of some of the questions we get. Next, thank you for that compliment. Great series. I can't wait for the entire webinar. I would definitely like the replay. Yes, the replay. It's really important, and I'm so glad so many people. We had over 130 plus people, I think 140 people register for this event. And a lot of them, if they can't make it, what's wonderful, when you register, you will actually get notified when this recorded series is available to you. Today's series is available. Like I said, we're going to have more series that are going to be condition specific. So like I said in the beginning of the talk, you need building blocks. If you don't have those fundamentals, those building blocks, then you're kind of left in the dark in the beginning. So we needed to give this first one, Cannabis Basics, some of those building blocks, so that way now we can go on to condition specific. You will know which conditions we are going to be talking about. We'll do lots of announcements about the next Leaf Learning series. Get the 411 on blank, and then that will tell you what that condition specific is. And then if that's something that's interesting to you and you're ready to learn about that, that's going to be another one that we'll be putting out those in a series of events. So thank you for your questions. Always look to our Leaf library. We put a lot of time and effort into that. We still work on it daily. Our nurses are working on it as they're fielding calls or waiting for calls to come in. We want to update some of those links and to articles and studies. So please always look at our Leaf library. We have so many resources on there. We have crisis support. We have the Marijuana Enforcement Division. We have some information about them. I definitely went ahead and I got some information from Quest Diagnostics. We've actually been getting quite a few questions about testing. How can I go about a urine test and know that I'm safe to test for a job when I've used legally in a state? And that's what's interesting. Everybody who have asked that question has used legally in the state, but they know they get tested for their job, so they need to know that information. And with each of these different types of questions that come through the hotline, what's wonderful is that it allows me to do more research. So I start looking into the answers to these questions. And it's fascinating on some of these. Now I know, what the average urine test is looking for, 50 nanograms, or a sensitive test is, could be 20 nanograms, and an extra sensitive could be 15, and the home test that you can do. So that way, when you really want to put your best foot forward, you want to make sure you pass these drug screens because you're ready for that. Great. Now you can be, you can really watch what your levels are, so that way you are feeling comfortable when you go to those drug screens and say, hey, I used recreationally or I used medicinally. I stopped that because I really needed to pass this test. Great. Now you know the information is right there in your hands. So we get lots of questions about all kinds of different subjects. Please feel free to keep asking me questions. I'll be right here waiting for you to answer them. We've got about 12 more minutes, and then I'm going to leave and go into peek around at our vendors. I hope everybody else is peeking around at all the sessions. I know there's the live tour. That's, got to be amazing. I wish I could be in watching that too. I'm going to peek around in there on their second replay. We've got dispensary tours going on. We've got live Q&A with CEOs, which, as you know, could be very tough to get. They're spending their time away from their family right now to say, I want to be there. I want to support Leaf 411, and I want to answer these questions. It's amazing to have some of the CEOs right there with you answering questions. So hopefully everybody is jumping around to those sessions. We've got more information on Leaf 411 in our expo booth, so please check that out. And always go to our website, leaf411.org. We have tons of information on there, and call us. Your funding needs, yes, and fundraising efforts. Thank you, Pam. That's a really important question. Our funding needs and fundraising efforts. Today, during this Leaf Learning series, was our first individual giving fundraising. It was our first time, talking to our public about our fundraising needs and what we use that money for, because you need to know. We want to, as a nonprofit, the wonderful thing about a nonprofit is they're extremely transparent. This is a public-owned company. It is not owned by anyone, even though I'm the CEO, Jennifer's the CEO. We don't own a penny of it. This is all for the public. You don't own it. You don't have stocks in it. You can't sell it. This is just something that you do for the public good. So this is a true public good. So our fundraising has to come through many different avenues, one of them being our cannabis industry. They were the first ones to step up and say, you know what? This service is amazing. We need this service all across the country because we want to make sure that our products are being used correctly, and that that people know where to go to buy their products. They're not buying them black market or from friends and families that may have really wonderful intentions, but you're opening a product that you don't know, ooh, what's in here? How many milligrams could I possibly be taking? So it's really important that, our cannabis industry are the first ones to step up and say, we're going to fund you for this. And they keep giving, which is wonderful. Next is government. We've been really going to our government agencies saying, gosh, how can we get some grant funding to help support this? We really want it to come from the government also to say, this is important. Our, all of our public, it's part of our landscape now. We voted for it. Different states have voted for it, but now we need to guide people safely. So we're really trying to recruit some of that, some of that grant funding. We have a wonderful grant writer who is really trying. We're applying for grants everywhere. So that is how we are trying to focus our funding, is grants, individual giving, if that's if you're able to do that, and then our cannabis industry and any other industries as well. If you know an industry that is cannabis neutral? You know, even cannabis neutral are open to learning about what we're providing because it's education, it's harm reduction, and that's key. Harm reduction, that's what our mission is all about, is using it safely. What sort of advice do we give patients that make their own edibles regarding dosing? Ooh, good question. Um, you know, it's interesting because we do have a lot of questions coming through the hotline on being able to afford medicine. You know, so we have to start thinking outside the box. We have to give them all the options available. I have a lot of people asking questions on trim, on different parts of the plant that they can use, that they can bake into products, and we've had some wonderful conversations about that. What's hard about that is knowing dosing. So it's knowing products that you can use, that you can accurately dose and get an even amount spread across, because that's even one thing our cannabis manufacturers have had to do. It's that even spread of that medicine to make sure that whether you take a piece from this area or a piece from that area, that you're getting that same dosing. Because accurate dosing is very important to know. Okay, if I took this piece of brownie that I made last night, is it going to have about the same amount of CBD or THC in it that I took the night before? You know, and really keeping track of that. So, you know, we do talk to our patients about using different parts of the plant in, like you're saying, in edibles, but also using that plant, if what they can buy is the flower, putting that in a smoothie. You know, there you get your THCA, your CBDA, wonderful compounds of the plant that can be beneficial for all kinds of different symptoms. So we talk about using the raw plant, and like I said, you know, using trim. You know, a lot of people say all I can afford is trim, you know, but what can I do with that? So we guide them on how to use that safely and effectively. How about other medical professional societies? Do you educate them? Sure, yes. We're actually in the process of partnering with different organizations. Americans for Safe Access is a wonderful one we're in talks with now. We are part of the clinicians, Cannabis Clinicians, Society of Cannabis Clinicians. We're a part of them. So, you know, we are trying to get our mission out there. And, you know, we started out, we haven't even been live with our hotline program, our first program, a year yet. So in October will be 1 year that we're out there. So mainly right now is getting people to know about who we are and the services we provide. And that's where we need everybody's help. You know, if we can get people to know that this service is here, that we're a nonprofit, that we educate, that we can help, also be that support. So a lot of what we do as nurses and have always done in the traditional setting is be that support for other medical professionals. Being there for these medical professionals, when you have these doctors and these clinicians all over that said, wow, you know, here's cannabis and I just studied all of this other, you know, my specialty, and now I've got to learn this. Well, here's us as a resource instead of them needing to focus on now I gotta learn about the endocannabinoid system, which is absolutely vital and important for them to learn. But in the meantime, not putting a barrier there between them and their patient. You know, they can actually come to us and say, hey, you know, I have a question. I'm a physician, or I'm a nurse, or, you know, social worker, or I'm actually out there with the public who is using. You know, I have questions. Where do I go for resources? And we can help guide them as well. So we are a resource for the public, and we're a resource for medical professionals and anyone out there that needs guidance. And that's what we do best, is guide. We would continue to educate them on platforms like this. We've actually been asked to produce educational content specifically for certain groups, which is exciting. But all that takes manpower. It takes more nurses and more staff, and that's where we're at right now. Is like, let's get that little funding machine going. We're hoping that other cannabis industry members that are not our members yet, but maybe thinking about it or watching us today, came to check us out today, and seeing all the interaction between everyone here, and we'll want to start becoming a member and supporting us. You know, that's what we really need, is that support. So thank you, Maureen and Pam and Rod and Catherine and Rebecca, for asking these questions. Like I said, you can go to our website and check us out there. We have lots more things that we could talk about, so please keep asking questions. And visit all of our members that are waiting in their sessions and their expos to answer all of your questions. We have about 3 more minutes left here in this booth, in this live sessions. Once we're done here in 3 minutes, I'm gonna leave, and I'm gonna start going around to the other areas, see if I can help out answering any questions in any of those other expo booths or anything like that. If you've got questions, you can call our hotline. We have a nurse ready to take your questions there. And if you ever get asked by any families or friends or coworkers about, you know, should I take this this whole candy bar, or what should I do? Or I just got this tincture bottle that has no label on it from someone. Do you think I should take that? You know, that's a good question for them to call and ask us, and we can help guide them on safe use. And you'll hear those words used over and over and over: safe and effective use and harm reduction, because that's our mission. First and foremost is taking care of our public, making sure that this plant medicine that they wish to introduce is used correctly. So that is always our #1 goal. All right, we've got a couple minutes left. I'm just going to check. Hi. Oh, thank you. Thank you for that. That's Heather. Hi, Heather. I'm so glad you could join us today. Heather is part of AMR, American Medical Refugees, a fantastic organization, really doing their best to help people who are struggling in states that have no legal access, to go to those states that have legal access. Those families uproot everyone to come to legal states to get their hands on medicine that could potentially help their loved ones, and that's really important. And we're doing our best to continue helping them through the Affordability Program. I would encourage everyone to check out that program, please. Look at all the details we have about that, and if you're in need, apply for through that program, and we will get you set up and to get emails and notifications on when we have donations and where we're able to dispense them out of. All that takes time and effort, and Heather and Amy are the true leaders of that Affordability Program, so please check that out. And if you know anyone that's in need, that's a great place to guide them to, is tell them about this resource. All right, I have 1 more minute left, and then this is going to shut down. I would welcome any more questions. Please, like I said, go into the expo booths, the sessions booth. They're going to be going on for another half hour in the sessions. And then once you see that red button, then you know when those new areas are lit up, and you can go and check those out. So the stage is closed now. As you see, the reception is closed. Sessions are still going on until 6 o'clock. And then the expo booths are open all the time, so you can pop in and out everywhere. So I encourage you to pop in and out, check everybody out, throw a question in there. Everybody will be happy to see you. And thank you, everyone, for coming to my live session. And if you have any questions, please reach out to me through leaf411.org. I'd be happy to answer your questions. I'm on the hotline too, so you can call me. You usually get me in the evening hours. But please come check us out in all of our programs. Thank you so much, and it's been wonderful being with you here today. I'm so glad everyone's really enjoyed this platform, and you'll get more of it in the months to come. So thank you so much.